Hello, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about anxiety. So, anxiety is a common symptom in complex chronic illness, and it's the number one symptom for Bartonella and or mold exposure. So, patients who have Bartonella and mold, their anxiety is through the roof, and they are chronically worried, wringing their hands. They can't sleep. Nothing is right. I mean, they are just a wreck. And that's because the presence of pathogens and mold in the brain causes severe neuroinflammation, and the neuroinflammation dysregulates the GABA neurotransmitter system. GABA, gamma aminobutyric acid, is the inhibitory neurotransmitter that helps keep the brain calmed down. And that frequently gets very, very disrupted in both Bartonella and mold exposure, as well as COVID and Lyme. But I would say Bart and mold are the real problems. And once that cascade begins, it's very difficult to get it under control. Very difficult. Lots and lots of times, patients will say to me, Dr. Marra, I have so much anxiety. I can't focus. I can't function. There are lots of natural things that you can do to help with anxiety. The first one is BH4 Assist, which is tetrahydrobiopterin. That's very, very helpful for regulating mood and getting anxiety under control. Another one is GABA, the actual amino acid, GABA. And you can take that at night. You can also take it in the day. It may make you a little bit sleepy, but that also can help. Another one is theanine. It's from the sunflower. Now, theanine can cause sleepiness, so you might want to make sure that, you watch when you take it. And another one is Valerian Root. And another one is DMG, dimethylglycine. Dimethylglycine is an amino acid, and it works great in combination with GABA and BH4 Assist to help people get to sleep. So, anxiety is not something that you want to fool around with because it's debilitating. If the nutritional supplements do not manage your anxiety, then you're going to need to go on a medication, a pharmaceutical medication. And one of them, those medications are usually benzodiazepines, which are very addicting and include things like Valium, Librium, Xanax, and Klonipin. They are highly, highly scheduled drugs. You have to get them from a psychiatrist, and they're very, very addictive, so you need to be careful with them. But in refractory anxiety, really, you pretty much always have to have a benzo. And the benzos help augment GABA. Okay, so they help increase GABA. When you go off of benzos, you have to taper them, and it has to be over a very long period of time. You cannot just come off benzos or you will be a total wreck. So make sure that you ask your doctor how to taper and to get off benzos. The nutrients, you don't have to really worry about titrating, although I always tell people it's a good idea to titrate everything. That way you don't shock the body. You just gradually come off something, and then the body can gradually adapt. So I hope you find this information helpful, and I hope you have a wonderful day.